They're so painful. Oh my gosh. Some of the worst mouth pain I have ever had has been due to canker sores. By the way, how many of you have had canker sores? Put it in the comments. And if you don't know what I'm talking about, let me take a step back. I'm Dr. Jen. It's good to see you. This is a canker sore. Okay. Sort of these shallow, like ulcers that can happen on the inside of our mouth, the inside of our, like a lower lip, upper lip, the inside of our jaws, the tongue, etc. And oh my gosh, can they be painful? They're usually between like 3 to 5 millimeters in diameter. They're usually circular or like a sort of an oval shape, but they can be bigger, by the way. And this is the thing. They often have like this whitish, sort of yellowish kind of coating on them, and they hurt. Oh my gosh, do they hurt? Okay. The good news is that a couple things you should know. Number one, canker sore, well, this is not good news, it's just a fact, but a canker sore is also called an aphthous ulcer. That is sort of the medical name for it. But number one, it is not a cold sore. A lot of people think that canker sores are cold sores. 'Tis not. It is separate. And canker sores are not contagious. Good news there. Okay, so that's important to keep in mind. And also, they tend to heal within, I don't know, 7 to 14 days or so, even if you don't treat it. But I'm going to give you some treatments that you can use or try at home, okay? Now, a lot of people wonder, they say, okay, why am I even getting these? Like, what in the world is going on? Because they're painful and they're just, ugh. Okay, first of all, we don't exactly know what causes them. Like, we don't exactly understand all the pathophysiology about, what's creating them and how they're coming about and this and that. But we do know about some of the things that can trigger them to come up. So let me tell you about those. Number one, stress. I tend to get canker sores when I'm stressed out. Stress absolutely can do it. Also, trauma on the inside of the mouth. So like if you bite your tongue or bite your lip like that, or you have like dental work, or there's some trauma on the inside of the mouth, that can sort of trigger canker sores. That can do it as well. Also, anxiety. Now, I think that kind of goes along with the stress piece, but you get the idea: stress, anxiety, etc. Also, something else to keep in mind: hormonal fluctuations. Okay, very interesting, and sort of maybe along those lines, women do tend to get canker sores more than men. Also, now I thought that this was super interesting. Okay, what I thought was super interesting is that poor nutrition can actually cause canker sores. Food allergies can actually trigger sort of canker sores. Certain foods, and possibly something called sodium lauryl sulfate, which sometimes is contained in certain toothpaste. Interesting, eh? These are some things that can trigger canker sores. Okay, now you're probably saying, okay, well, what do we do about these? How do we get rid of them? Well, let me just first start by telling you what I do when I get canker sores. What I personally do is, first of all, I'm really careful about what I eat and drink. Why? Because certain things are going to irritate it. I know spicy foods are going to irritate my canker sore. I also know things that are hard, like toast, things with sharp edges or whatever, are totally going to irritate the canker sore, and it might be really, really painful to eat. Okay, I'm going to be very, very careful about what I'm eating. I'm also going to try to avoid trauma just in general. So when I'm brushing my teeth, I'm going to use a soft toothbrush and things like that, and try to be very gentle with how I'm brushing my teeth and doing my oral hygiene. The other thing I'm going to do is I tend to go over the counter and get something called benzocaine. Benzocaine is an oral topical anesthetic. Okay, there's a lot of different types of brands over the counter. And again, I'm not your doctor, so you need to talk to your doctor about what you can take. Okay, I can't tell you what you can take. This is what I take, but run it by your doctor. I generally get a little bit of benzocaine, and it's like a little gel, and then I put some on my finger and I put it on the thing and kind of let it dry, and it kind of creates a coating and numbs the area and sort of helps. Kind of usually helps me get through a few days when the canker sore might be at its worst. So that's definitely a suggestion for you to run by your doctor to see. Now, there are other treatments that we can do, okay? First of all, I should say as well, if you just have one canker sore here and there, blah, 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 okay, whatever. But if you find yourself with very large canker sores, with recurrent canker sores, they're all over your mouth canker sores, you got other symptoms, fever, lymph nodes, other things, like something's not right, you absolutely need to see your doctor, and don't even try to treat this on your own. You want to make sure you get a proper diagnosis, okay? But other things, other treatments that your doctor may recommend and by the way, if I didn't say this, treatment is not necessarily needed for many, perhaps even most people. Treatment often just helps it sort of feel better as it's going on and possibly heal faster. But you don't have to have treatment for most canker sores, like simple canker sores, for it to go away. Okay, keep that in mind. But some doctors recommend avoiding this sodium lauryl sulfate ingredient that can be in some toothpaste, so avoiding that can be helpful for some. Also, using certain types of mouthwash. You don't want to use a mouthwash with alcohol in it because that can really be not so great in terms of irritation. I mentioned the benzocaine, which is what I use over the counter. And also, like we doctors, we can prescribe, sometimes we may prescribe steroids, either systemic or topical. We may also prescribe certain mouthwashes with different ingredients in them, whether it's chlorhexidine or hydrogen peroxide or things like that. There's something called magic mouthwash that can help sort of numb the inside and make you feel better. Point being is there's a lot of different options here. Like I said, though, I typically just go over the counter, get some benzocaine, etc. But you need to talk to your doctor about to find out what you should be doing, because it might be different for you. Most important things here is understanding that these canker sores, guys, they can happen. There are these triggers, so just sort of keep that in mind. If they're super bad or look super crazy and like you're like, this is not right, see your doctor. But also understand, as I mentioned before, these are not the same as cold sores, and they are not contagious. So guys, I hope this is helpful. Let me know right in the comments. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos on all sorts of things. So please, on Facebook, please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. I'm on TikTok and Instagram and WhatsApp and all sorts of stuff at Dr. Jen Caudle. Make sure you follow me there. And go to my website, drjencaudle.com, so you can sign up for my free weekly health newsletter. Guys, I'm Dr. Jen. See you soon.